for joining us today for an important webinar on children's environmental health. I'm president of First Focus on Children, a child advocacy organization dedicated to ensuring that children and families are a priority in budget and policy discussions. When it comes to climate change and its subsequent health outcomes, children are often an afterthought. Yet it is their health and their futures that are most at risk if we do not act. And the threat of climate change grows increasingly urgent with each year. This past summer, communities across the United States and the globe experienced more extreme and frequent weather events and environmental challenges: hurricanes, wildfires, heat waves, and drought due to climate change than ever before. And according to UNICEF, almost every child on Earth is exposed to at least one major climate and environmental hazard, shock, or stress. Unfortunately, communities of color and lower wealth and the children who live in those communities experience the greatest impacts. Further, these communities are often already experiencing hardship, death, and disease due to environmental exposures and risk, exacerbated by COVID. Their resources are stretched, and their infrastructure, including their homes and schools, are often stressed and crumbling. Exposure to environmental toxicants impact children differently and often more severely than adults. Children's physiology and behavior make them uniquely susceptible to environmental pollutants. For instance, children drink more water, eat more food, and breathe more air in relation to their body weight than adults. They also exhibit hand-to-mouth behavior frequently and live and play closer to the ground. These differences put them at much higher risk of being exposed to environmental threats such as air pollution, water pollution, and toxic substances, and their unique needs must be addressed. The Biden administration's commitment to address climate, environmental, and social justice and the recent passing of major bills and investments to address these issues hold great promise, especially for those experiencing the greatest impact. I also want to flag the imminent release of our annual children's budget publication, which tracks federal expenditures on children. The 2022 Children's Budget Book marks the first time First Focus on Children is devoting an entire chapter to tracking government spending on environmental health. As the changing climate accelerates its impact on our future, leading young people to stand up to demand change and defend their future, tracking federal expenditures to protect the environment and its impact on health has become more important than ever. In any conversation on climate and health, we must keep those experiencing the greatest impact, children, front and center. This webinar will do that, highlight why and how children must be at the center of climate and environmental justice and of the recent federal investments and policies, Justice40, the Inflation Reduction Act, and the Infrastructure Bill. Before I introduce our four excellent panelists, we will hear opening remarks from Senator Ed Markey from Massachusetts. For more than 40 years in Congress, Senator Markey has been at the forefront in both the House and Senate on issues ranging from energy and environmental and climate change policy to telecommunications and children's online privacy and non-proliferation and arms control. And on a bipartisan basis, Senator Markey has passed more than 550 pieces of legislation into law. For 4 consecutive years now, he has also been named a champion for children by First Focus Campaign for Children in our legislative scorecard. So thank you for joining us today, Senator.
Hello, everyone. I'm Senator Ed Markey. Thanks for having me today. I want to thank First Focus on Children and the Children's Environmental Health Network for hosting this webinar on the incredibly important topic of children's health and the interconnection with climate, with justice, and the built environment. The old saying is that children are our future, but for that to be true, we need to give them a livable future. Children are the most vulnerable to the impacts of climate change. Children today will face 3 times as many climate disasters as their grandparents did. In 2021 alone, 40% of Americans, nearly 132 million people across our country, were harmed by climate change and extreme weather events. Fires in the West, freezing cold temperatures in Texas, extreme heat in the Pacific Northwest, flooding in the Gulf of Mexico, and rising sea levels in New England. These tragedies took the lives of more than 700 people in the United States in 2021. That's 700 lives, 700 families, 700 people who should still be with us today. And two major heat waves likely caused hundreds of more deaths above the official tally. Doesn't even get counted, but we know it's real. The climate crisis is not at our doorstep. It is in our homes. It is here. Just last month, Hurricane Fiona left all of Puerto Rico without power. This week, millions of people in Florida evacuated from Hurricane Ian, which tore down power lines and destroyed homes all across Florida. These tragedies are terrible for all of us, but children are disproportionately harmed by this change which is taking place. Young children are more likely to die during natural disasters. Air pollution harms their developing lungs. Extreme weather prevents children from accessing their schools and their hospitals. And their mental health will be forced to contend with the trauma of all of these crises. The compounding threats affecting our country today continue to grow. Mounting economic inequity, climate change, racial injustice, and healthcare crises all require a bold, intersectional, and immediate response from the federal government. We have to act and act urgently. That's why I've been fighting to make sure we center environmental justice and equity in the fight against climate change. It is critical that we successfully carry out President Biden's Justice40 initiative, which will deliver at least 40% of the federal government's investment in climate and clean energy to disadvantaged communities all across our country. We know that they have been disproportionately negatively impacted historically. I fought for $60 billion in critical investments for environmental justice in the Inflation Reduction Act, considered the most significant investment in environmental justice and climate action in American history. And I'm still fighting to get the rest of our important priorities across the finish line, such as my Protecting Moms and Babies Against Climate Change Act and my Get Toxic Substances Out of Schools Act. We know what the problems are. We just have to make sure that we make the investments in order to solve them. These investments are a first step towards securing a healthier future for all children. Climate justice for children is racial and economic justice. Ultimately, we need the help of leaders like yourselves to ensure that we can continue to make the bold and equitable investments that all children need and deserve. If we want to see a world where children have clean air to breathe, safe schools to learn and play in, health care that they can access, and loving and stable families to grow up in, we must continue fighting for climate solutions with equity and justice for children at their heart. Children have the most to lose from past generations' failure to address the climate crisis, and we also look to them as the leaders of a better tomorrow. We should follow them. We should let them be our leaders on climate change. It's our responsibility to pass down to them a better planet. Let us follow their leadership. You are critical partners in the grassroots movement to combat climate change. Thank you for all that you are doing. You are truly doing God's work here on Earth to protect our precious planet.
Thank you so much, Senator Markey, for kicking off this important conversation and for your call to action. Really very much appreciate your consistent leadership and support for children and families in this in all these conversations. So with that, I will now introduce our great panelists today. First, we are joined by Nsedu Witherspoon. Ms. Witherspoon is the Executive Director of the Children's Environmental Health Network and has been a leader in children's environmental health for over 22 years. She serves on the External Science Board for the Environmental Influences on Child Health Outcomes, NIH research program, and she co-leads the health science initiative of the Cancer-Free Economy Network and is co-chair of the National Environmental Health Partnership Council. Next, we're joined by Amanda Reddy. She's executive director of the National Center for Healthy Housing, an organization founded on the premise that better housing can be a powerful platform for better health. Over the last 15 years, she has worked with communities to effectively prevent housing-related illness and injury by implementing evidence-based and equitable policies that improve housing quality. We are also pleased to be joined by Dr. Leslie Rubin, an associate professor in the Department of Pediatrics at Morehouse School of Medicine, adjunct associate professor in the Department of Pediatrics at the Emory University School of Medicine. And he's also the director of Break the Cycle programs that's located in the Southeast Pediatric Environmental Health Unit at Emory University in Atlanta, Georgia. And finally, we're joined by Devin Nennen. Is that right? Did I say your name right? Devin is a fourth-year undergraduate student at the University of Florida, majoring in sustainability studies. She is a research assistant in the Department of Environmental and Global Health and the Department of Environmental Engineering, where she participates in projects focusing on environmental epidemiology and soil contamination in the state of Florida. Thank you all so much for joining us today. I will now turn it over to Nsi to set the stage on children's environmental health and equity.
Thank you so much, Bruce, and hello to all my fellow colleagues, and thank you for everyone attending. Well, the vast majority of Americans do believe that climate change is actually happening and that humans are a big part of the detriment, the negative sides that we've been impacted and experiencing for decades now. As our panelists have been discussing, and Senator Markey also reiterated, children are more vulnerable to adverse impacts on their environments, again, where they live, where they learn, where they play, more so than adults while we're all impacted. We have all experienced these extreme and frequent weather events and environmental challenges, some more than others. And as Bruce mentioned, again, the hurricanes, the wildfires, the heat waves, the droughts, the flooding, increased vector illnesses, and the allergies, which I personally come in contact with every seasonal change now, all are connected time and time again to climate change. Unfortunately, Indigenous communities, communities of color, lower wealth, pregnant women, and the children who live in these communities experience the greatest impacts of climate change. So these impacts include mental health, trauma, stress, displacement, rising heat index, also as a part of this, increased respiratory illness, water contamination, either too wet or too dry soil is still not optimal. And many of our agricultural leaders have told us we are only a few crop cycles away from serious detriment. Generational impacts leading to continued cycles of health disparities as well. And many sources are sounding the alarm. The American Academy of Pediatrics has a policy statement on this. The Lancet report every year now has a focused attention on this, UNICEF, and a variety of other reputable peer-reviewed sources. So further, these communities are often already experiencing hardship, death, disease due to environmental exposures and risks exacerbated by compounding impacts such as the impacts of redlining policies, lack of community investment, and most recently, the COVID-19 pandemic, which is still happening. Their resources are stretched and their infrastructure, including their homes, their childcare facilities and schools, just to name a few, and work environments are also stressed and in many cases crumbling. We do not need any more reasons to ensure that children and equitable solutions serve as the center for the recent federal climate and infrastructure investments and policies. Again, I'm with the Children's Environmental Health Network. We are proud to be celebrating 30 years as the only nonprofit working in the US to entirely focus our mission on protecting children from environmental hazards and thinking seriously about where they spend the most time. We serve as a leader in the climate change arena, cancer prevention, thinking about the major routes of exposures, air, water, built environment, and are leading our children's environmental health movement. We are a part of and stimulate the necessary peer-reviewed science of which we are sitting on many, many years of and not moving into action that are protecting and providing protections for our communities. Vast majority of our work focuses on translating, educating, training, and providing technical assistance so that every single one of us out here, regardless of where we are in our society, has an equal chance to at least uplift our lives and have a better understanding of the decisions that we can take for our health and that of our loved ones and our broader community. Bruce addressed the important ways that children are vulnerable and the threats that are facing them every day. Looking at environmental injustice, we know that no group of people, regardless of ethnicity, social economic class, should suffer disproportionately from environmental health hazards. Dr. Beverly Wright with the Deep South Center for Environmental Justice has said many times that communities of color are in double jeopardy from the climate crisis. And of course, our children, our indigenous communities, communities of color, and those living in low wealth communities are more likely to live on those front lines of the climate crisis. Low wealth communities are less likely to have health insurance, access to medical care, and certainly that has a negative impact on the children in those situations. Hispanic community members are the first to lose their jobs and the last to economically recover, according to the California Water Coalition. Again, mental health, trauma, displacement, these are all critical when we really think about even a child that has had their life through major implications from climate change, the lifelong implication that that child then has to suffer through by what they've seen or what they continue to go through as a result of 1, then 2, then 3, and multiple episodes is just completely alarming. The health impacts upon our most vulnerable are real. We know that childhood cancer has decreased in incidence, but mortality has decreased. Incidence continues to increase steadily for the last 47 years. You cannot attribute that to genetics alone. There's other things happening in our environment that is consistently feeding that incidence rate. We also know through a report that the Childhood Cancer Prevention Initiative that we're a part of put out a few years ago is that major routes of trends to childhood cancers include exposures to pesticides, vehicle air pollutants, paints and solvents, all of which are, many of them, the exposure pathways are exacerbated by climate realities. Childhood asthma is still the #1 chronic illness among children, and that has been the same since I started my work in public health over 2 decades now and before. Childhood lead poisoning, we'll hear more, I'm sure, about that, is not completely addressed, despite having more than enough science to act. And we know that many states are mandating and some are not. There's a level of inconsistency. There's not a mandate of testing drinking water, for example, and lead in schools. And when we had the situation with our COVID pandemic where schools were closed and then reopened, you know, I'm not at all going to blame an already overstressed education system, but we collectively put a lot on them to open up these schools and not mandate or expect or give them capacity to make sure that they were testing their pipes, testing for all kinds of environmental health related concerns, since those buildings were closed up for a good year plus. That's just one prime example of how we have to do a better service for our environment, our educational community, our communities as a whole. Childhood neurodevelopmental disorders continue to rise, with Black and Hispanic children most impacted and Indigenous. The increased prevalence of these disorders cannot be entirely explained by genetics as well. We have a Black maternal health crisis that we are in the midst of. Women of color, and especially Black women, are most disproportionately impacted by environmental injustices and climate change related poor reproductive and birth health outcomes. And also, I would offer that children are still not being valued and taken seriously in my final remarks. All of the science and lived experiences are not being moved into action. This applies to food, air, water exposures, toxic chemicals in the marketplace, and hazards in the places in which they spend the most time. The Biden administration's commitment to address climate, environmental, and social justice, and the recent passing of these major bills and investments to address these issues holds great promise, especially for those experiencing the greatest impact. Let's ensure that children must be at the center of climate and environmental justice and of the recent federal investments and policies, specifically the Justice40 initiative, the Inflation Reduction Act, and the infrastructure bill. Thank you.
Amanda?
Great. Thank you, Nse, and thank you to First Focus and the Children's Environmental Health Network for the opportunity to be a part of this conversation today and for the opportunity to reflect on and give voice to the special and unique needs of children. I'd like to spend my time making the case that we won't be able to significantly improve children's health and well-being and to prevent the worst impacts of climate change on them if we continue to ignore opportunities to invest in what is one of the most important settings for children, the home environment. Even before COVID, Americans on average spent about 70% of their time in residential environments, and children, particularly very young children, tend to spend even more time at home. Let's remember, for instance, that a majority of children under 5 receive their care at home, whether their own home, a family member's home, or a home-based daycare, so that even when we're talking about early learning environments, we're frequently also talking about homes. And there's a lot of talk about housing out there right now, but there's also a failure to talk about and invest in improving housing quality. On a good day, on an average day, and we haven't had very many of those lately, but on a good day, this needlessly exposes millions of children to a wide range of environmental hazards and misses opportunities to not only improve health, but also academic performance, economic and climate outcomes. And we do mean millions of children. An estimated 45 million US homes have one or more health or safety hazards that can cause significant illness, injury, and even death. And as we've already heard today, these risks are not equally distributed across the nation. For example, Black Americans are nearly twice as likely to live in homes with severe physical problems, and these disparities in housing quality drive and exacerbate disparities in health outcomes. So as a result, Black children are more likely to be exposed to lead. They're more likely to have and die from asthma and are at increased risk for injuries at home. And that's before we even layer on the challenges of pandemics or climate change. Global threats like COVID-19 and climate change haven't created these disparities, and we could have a whole separate conversation about the historic and ongoing racist housing policies that are responsible, but they have unmasked and exacerbated them. I think we can all acknowledge that not everybody has been able to be safer at home over the last couple years of this pandemic, or even over the last week for those in the path of Hurricane Ian. If being at home means increased exposure to lead, to asthma triggers, to other hazards. Yet housing remains so central to our response to future pandemics and climate-related events like hurricanes, floods, wildfires, extreme heat, and extreme cold events. Housing has a role to play in keeping children safe before, during, and after all of these. So we hear a lot of talk out there about affordable housing and resilient housing, and both are critically important, but I'd suggest that there's nothing affordable about having to miss work because of your child's repeated asthma attacks, and that it seriously undermines the investment in resiliency if your home can withstand a hurricane or another climate-related disaster, or it has reduced energy emissions, but it also poisons your child. It's also important, though, I think, to recognize that housing isn't just the problem. It's also a powerful solution that can benefit multiple priorities of this administration, of this Congress, whether we're talking about health outcomes, educational outcomes, racial justice, jobs, home values, energy emissions, if we make the right kinds of investments. As one narrow example, replacing old lead-painted windows with new energy-efficient ones eliminates a major source of childhood lead poisoning, decreases home utility bills, reduces carbon emissions by improving energy efficiency, improves home values, and creates thousands of jobs for window manufacturers and installers. But currently, programs that have the ability to replace windows miss this opportunity because their funding either prohibits or disincentivizes them from considering those kinds of co-benefits. Similarly, if we do it right, electrifying homes can be an effective way to reduce harmful energy emissions, to reduce costs for families, and improve health. Heating, cooking, and cooling are all major drivers of energy use in homes, and we're likely to need more of all of them as those climate events, those hurricanes and floods, those extreme heat and cold events increase in their frequency and their duration and intensity, and we all spend more time inside and at home. Making that energy use more efficient isn't just helpful, though, for reaching our climate goals. It can also confer significant health benefits. For instance, children who live in homes with gas stoves compared to electric stoves are more likely to be diagnosed with asthma. A recent study authored by my organization found that even with mechanical ventilation, which, let's be clear, most of us, including over 90% of renters in this country, do not have access to mechanical ventilation. But even with that, that was not enough to eliminate all of the indoor air quality risks associated with having a gas stove at home. Lower income and BIPOC residents may also be disproportionately impacted by these poor indoor air quality risks, risking increased exposure due to often living in smaller homes or older homes and having higher rates of asthma to begin with. And it probably won't surprise anyone that, despite the fact that we have all of these proven solutions, that one of the major reasons these ideas haven't been implemented even more widely comes down to funding, and specifically funding at scale that is easily accessible to residents and the residents that need them, and that isn't siloed from other related priorities. Our current programs, like the HUD grant programs focused on lead and healthy housing that are highlighted as a priority in the Justice40 initiative, are incredibly effective, but they're too limited in scope. There are a lot of communities that don't have access to these funds at all. And even those that do are often constrained by unnecessary program requirements that leave too many communities and families and priorities behind. We have recommendations of how to reform these programs to make the investments that have already been committed more effective for our most affected communities and residents. It's also worth noting that we've seen a lot of innovation on the ground of how communities are allocating American Rescue Plan Act funds to invest in improving housing quality, and that's a great model for how we can do better. We are also encouraged by the inclusion of several healthy housing related investments in the recently passed Inflation Reduction Act and how clearly they are connected to climate and resiliency goals. After failing to recognize housing as infrastructure in the bipartisan infrastructure law last year, we are hopeful that a new consensus is finally emerging that climate is inextricably linked with health, housing, and equity, and that so are the solutions. These investments in existing programs and new programs at HUD, at EPA, at DOE, and others are a good start. But we also need to do more to first make sure that these investments that have already been committed are implemented effectively and equitably. And second, that we recognize this as the down payment that it is, and that we all work together to sustain and scale these investments. Those of us who work in housing quality have a lot of ideas and examples of what works, because these are problems we can solve. They're problems that are worth solving and that have cost-effective and proven solutions. And these recent commitments made through the American Rescue Plan Act, through the Inflation Reduction Act, can set the stage for real and lasting change if we take this holistic view and invest in improving our nation's housing quality with a resilience and equity lens, so that we aren't choosing between addressing legacy environmental hazards like lead or emerging ones like climate change. We don't have to choose. Our children shouldn't have to choose. We can do both. It isn't an either or. We can learn from the past, set future generations up for health and success, and let benefits instead of harm snowball across generations. And there's no better reason to do so than the children, who are the focus of today's conversation.
Thank you so much. Dr. Ruben.
Thank you so much. Thank you, Bruce. Thank you, Nse and Haley and everyone. Thank you for inviting me to this particular session, which I find particularly valuable. I'm just going to show you my slides so that see, slideshow. There we go. All right. So what I'm going to talk to you about is a program called Break the Cycle of Children's Environmental Health Disparities, and then we'll translate that into climate change space. And first of all, disclaimers that everything I say is other people are not responsible for. And then I want to talk to you about health disparities. What does health disparities mean? It means that some people are healthier than other people. And in this particular graph, you will see that on the bottom, it says wealthy mothers, and this is infant mortality. That is infants who die before their first year of life. It will be per 1,000 live births, and the wealthy mothers is 2 per 1,000 live births, which is about the best you can get in the whole world. And the ones who are disadvantaged are 5 per 1,000 live births, which is what you'll get in much less developed countries. And that is in the US of A. Now, Who are the poor children who represent those that are at a disadvantage? Because the disadvantage is poverty. And if we look at this US census, we'll see that most 60% of the population are white, almost 20% are Hispanic, about almost 25% are Black, and a very small percentage, less than 5%, are Native American. Now, who are the children who are poor? 11% of the children who are poor are white, and they represent actually the largest number, which is about 22 million children. So they're a big number, but they're disproportionately represented by those children who are Black and Hispanic, who represent over 30%, which is like about 14 million on the Black side. And also, if you have a look at the Native American population, who are really minuscule in their representation in the US, they represent a much higher percentage of children in poverty, although the absolute numbers are smaller. The representation of children who are poor is greater. So those are the disparities, the income disparities, the financial disparities, the profile of poverty in the United States. Now, if we look at where the poor children live, they live in older houses, and you just heard about this from Amanda, and she said it much more eloquently than I did, that they're more likely to have lead toxicity, which affects brain development and function and ultimate ability to earn a living as they get older. And they're twice as likely to have asthma and 3 times as likely to die from asthma. They live in unsafe neighborhoods with limited green space. They're much more likely to be obese than the general population, and they experience violence, which affects their mental health or conscripts them to a violent culture. And also, they're in older schools in poor condition, and these schools are physically in poor condition, and also the teachers are less likely to be well paid, and they are less likely to be as energetic and enthusiastic. So the kids who are in these poor schools are less likely to graduate. In fact, only about 50% will graduate. And that is just such a poor showing. And if we look at the impact of climate change and heat, you'll see that those who live in the downtown area, in those areas with a lot of concrete and less green space, the temperatures are up to 10 degrees higher. So whatever it is that anybody else suffers from heat or any other climate change phenomenon, they're going to suffer more from the climate change than their suburban counterparts. And if we look at a poor child who in this typical profile happens to be African American, we look down the left-hand side of the column: poverty and racism, lead and other toxins, unsafe neighborhoods, impact of climate change, stressed mothers, insecurity and anxiety, and then limited education, and on top of that, limited access to healthcare. So these kids are less likely to be healthy. So if we take all these factors, we construct them into this cycle of health disparities. On the top left, it says social and economic. They have limited education, limited employment options, limited income. They have limited healthcare services, limited social capital. They're more likely to have food insecurity, housing insecurity, and to live in poor and degraded environments with crime and violence. And then they suffer from chronic emotional stress as well as environmental exposures. And that's the picture I just showed you before, where the environmental stresses and the chronic stress affect the physiology and result in these adverse health outcomes. We look at poor pregnancy outcomes, like more likely to have premature infants. The kids are more likely to have asthma, obesity, heart disease, developmental disorders, and also mental health disorders such as toxic stress and post-traumatic stress disorder, substance abuse, and violence. And then, because this is a cycle, we realize this is intergenerational. These kids get trapped as they get older into this intergenerational cycle of health disparities. So the question is, how can we make a difference? There's no one person who can make a big difference. And obviously, with the powerful backing of the money coming from those federal resources, we can all make a better difference. So I'm just going to tell you how we make a difference. And what we do is we recruit bright, creative university students to develop projects that will break that cycle at any point. We then have the students do projects and present at a national conference. We then have them write up their project for publication. Society benefits from this increased knowledge, and these students then go on to become our future leaders. So this is how we break the cycle, but anybody can break the cycle at any point. And I just want to give you an example of what happened this past year when we had a whole cohort of students doing projects. The one student did a project on socioeconomic disadvantage and low gestational age newborns. Devon Nennon, who you're going to hear from in a moment, did a project on redlining and environmental justice, roots of child health vulnerabilities to climate change. Another student did inequities in lead exposure. Another one did water infrastructure and lead exposure. Another one did about pediatric environmental health centers in urban centers. Another one did a project on climate health and equity. And the ones in red are related to climate. And this one is the effect of activism on eco-anxiety in adolescents. And we need this mental health issue of anxiety related to climate change. And one did knowledge as a way to end environmental health disparities. So over the past 17 years, we have had 17 annual programs from students in 21 states in the USA, 6 countries in Latin America and Africa. We had 180 students from 54 university departments, and we've had their papers published in 13 international journal supplements, 13 books. The first international journal supplement was the International Journal of Child and Adolescent Health. Our first book was Break the Cycle of Environmental Health Disparities, Maternal and Child Health Aspects. And the last one we did was on environmental justice and the intersection of poverty, racism, and child health disparities. We are now turning our attention to breaking the cycle of climate change, where we will use a similar model to do this. We have not begun it yet, but we had our test program last year with our 3 programs. So as we go forward, we say each one of us can do something, and we have to do something. We may not necessarily be able to complete our task, but we're not free to desist from undertaking the challenge. Thank you.
Thank you. With that, Devon, we'll turn it to you.
Hi, I'm going to share my slides real quick. 1 second. Here we go. Okay. So thank you so much, Dr. Ruben, and thank you all, Bruce, everyone. As Dr. Ruben said, I was a student in this past year's Break the Cycle cohort, and I'm here to talk to you about my project, Redlining and Environmental Justice, Identifying the Roots of Child Health Vulnerabilities to Climate Change, that I did with my mentor, Dr. Eric Coker, and master's student Yui Fuji. And I'm also just going to give some information on my experience with the Break the Cycle program. So my project primarily was about redlining, and just to give some background on that, redlining was a discriminatory housing practice that was practiced by this organization called the Homeowners Loan Corporation, which I'll probably shorten most of this presentation to just HOLC. So the HOLC was a federal government agency that was created by Roosevelt as part of the New Deal with the aim of reducing foreclosures by offering refinancing of home loans. And so as part of their plan, they created an assessment system of mortgage security in different communities and different urban areas. And to do this, they created maps like this one shown here that assigned different neighborhoods, different grades, an A, B, C, D grade, based on how safe they were considered for lending. But these assessments were, in reality, primarily based on race. So this created, so the hazardous, like the primarily Black neighborhoods were called hazardous and were assigned a letter grade of D and were highlighted in red as shown on this map, which is where the term redlining comes from. These redline neighborhoods were denied home loans and investment, which created a system that barred non-white people and communities from obtaining loans and investing into their own communities. This was formally practiced from the 1930s to the 1960s and has since been made illegal. The effects are still very visible in cities today. So in our project, we wanted to look at redlining and see how it relates to environmental health, specifically looking at the Southeast with Alabama, Georgia, South Carolina, and Florida. So we looked at each of these environmental factors like temperature, humidity, air pollution, future projections for what temperature might be with climate change in 2080, which are all factors that are known to be associated with worse health outcomes, especially for children. And we compared them in redlined and non-redlined neighborhoods to see if the people in these, sorry, the automatic lights just went off, to see if the people in these communities are facing a disproportionate environmental burden. So just to quickly look at our results, this is just the first part of our analysis. And in the interest of time, we're just going to focus on this one figure. So this figure shows each of the environmental factors that we looked at stratified by each of the HLC grades. So separated by if the neighborhood was redlined or not. All of these, as you can see on the figure, get worse as you go to the right, with those red boxes generally being the highest. So this suggests that residents in historically redlined neighborhoods face a disproportionate environmental burden, which can lead to worse health outcomes. This is just a snapshot of our results, but the rest of our analysis is a very similar story. And with some of the other aspects of our analysis, we're actually able to identify specific redline neighborhoods that are facing higher levels of childhood poverty, environmental inequalities, high levels of residential segregation, and projected worse outcomes for climate change, which are neighborhoods that we believe should be prioritized for mitigation and for informing local action. So our project breaks the cycle by providing an important metric that can be used to identify at-risk communities, and it gives greater insight into the structural roots of these health disparities. There's a very clear connection between structural racism and environmental health disparities, and it comes from a lack of economic investment in these neighborhoods, such as due to redlining, which leads to limitations and degradation of the environment and causes greater exposure to environmental stressors, ultimately resulting in greater health risks. We believe that mitigation of these risks is possible, but projects like this provide the focus and direction that can make it more effective. So just lastly, I just wanted to talk a little bit about my experience with the Break the Cycle program and working with Dr. Ruben. Overall, it was a really great experience and has been really instrumental in developing my skills as a research assistant. I'm only an undergraduate and I'm very new to research. This was actually the first big project that I've participated in. And I have seen just like such immense growth in myself as the project has gone on. I'm sure Dr. Ruben could attest to the fact that the way that I was able to speak about my work and about the research that I was doing at the very first Break the Cycle meeting is astronomically different from how I'm able to speak about it now. And I think a lot of that comes from just working with all of the people in the program and being able to learn from all of them. We were split up into different groups of projects that were related at each of the meetings. And I was able to learn a lot about a lot of the projects that other students in the program were doing. And this was just being able to see the variety of the projects and learning about the other research that is out there has been super helpful for me as a student. I think overall, the most important part of the Break the Cycle program is working with all of the other people within it. Dr. Ruben, my own mentor, all of the other directors and mentors within the program, and also all of the other students has just opened my eyes to so many more aspects of environmental health disparities. And I've been able to learn from them to develop my own skills and to develop like what I might want to do in the future. Not even to mention the opportunities that the Break the Cycle program has given. I was able to present at the National Environmental Justice Conference in DC back in March, presenting at the Break the Cycle conference itself in April. Just the opportunity to get published, to be able to speak at events like this has produced so much growth in myself and has really directed how I want my future to look and has really inspired me to want to stay involved in this field and in this discipline. Overall, the Break the Cycle program has been just such a great experience and has taught me so much. And I can't thank Dr. Ruben and the rest of the Break the Cycle team enough. Thank you so much.
Well, thank you all so much for your presentations. And so, first question, does anyone want to respond to anything anyone else had to say? I think there's, really great presentations about different aspects of, and I really like how you guys all attack this from a sort of multifaceted policy perspective and sort of addressing sort of the whole child's issues around environmental health and justice. So does anyone want to add anything? And say, I know you do.
Well, thank you. I just wanted to, again, thank, I know everyone's very busy doing incredible work here. And, these are not new issues. You heard a lot of overlap in a lot of our discussion points, and it can get frustrating, right? That what we're talking about is something that I haven't heard in public anyway, people being actively against as far as when it comes to protecting children, and yet our actions don't line up in our funding and our capacity, and thinking about where kids spend time, like their learning environments of all levels have yet to really garner our political attention, our funding, budgeting attention, or quite frankly, our training capacity attention. I definitely don't want to speak for our educators, but I certainly do. I'm a mom of 4. I'm a PTO officer, parent teacher organization, and I do engage with our education advocates often. We have Claire Barnett, for example, on with the Healthy Schools Network, who's been posting some great resources, and thank you to attendees who've been posting. And we hear time and time again of how inundated they are on a day-to-day basis with the important other issues of educational attainment that they're trying to work through every single day, and what children are dealing with at home and bringing to school. And then on top of that, we put a lot of them in harm's risk just by going to work every day, by the nature of the environment that they're working in. Many are women of childbearing age, and of course, again, the children that they're serving. So it's not like we don't know where to start. All of our presenters have provided some very great examples of going in the right direction, trying to reverse and change the paradigm and shift our systems that have gotten us here. The status quo is not going to work. And, we can't be surprised if 2 years, 3 years, 5 years down the line, we're worried about even more extreme situations and again, more negative health outcomes without having any change of our course of how we're going about conducting ourselves. So that's my quick summary. And I with great appreciation for everyone bringing yourself and your best work here for us today.
Absolutely. Anybody else? Also, for people in the audience, please, if you have any questions, put them in the chat. Go ahead, Dr. Ruben.
I just want to thank those of you who organized this session, because I think the more sessions like this that kind of bring to the fore the challenges that we face as a society and try to raise awareness among larger and larger numbers, I think that's where the big difference is going to come. Because a lot of people live very comfortable lives on their own, or struggle day to day on their own. And if we can raise awareness and bring everybody to the realization that we all have to do something, each one of us, if we do a little bit, will make a difference in the whole world. So we just have to encourage everybody to realize what's going on and to make even the smallest difference they can make, so that together we will change the world for the better.
Tara Jordan has asked a question. She asked, can you describe environmental factors thought to be related to premature birth? What types of actions and or research is needed to reduce premature birth related to environmental harm?
Yes,
I
thank
guess
you so
that
much.
one's for me, right?
Yes, that's good. Yes, please.
Well, there are many factors that do result in premature births, but I'm just going to speak about 2 of them. One, environmental, which is related to air pollution. Air pollution is very clearly linked to premature birth. And the second, which is stress, maternal stress. And the maternal stress can be personal, emotional, but also can be racial. It is shown that usually poor women are more likely to have premature infants, but professional women of color are more likely to have premature infants than their white counterparts. So this presents the case for the fact that things like racism, whether they're overt or covert, can result in real adverse health outcomes. And one of the adverse health outcomes is prematurity, because infants who are born prematurely are much more likely to have long-term neurodevelopmental disorders, learning disabilities, and even more serious neurological conditions.
Amanda, do you have?
Yes, I just wanted to also echo my appreciation for being able to be a part of this conversation today that I think conveyed both the urgency and the seriousness of this topic, but also a lot of reason for hope, that we do have strategies available to us, that there are communities and individuals and residents that are putting strategies into action right now to create real change. So I just want to thank my fellow panelists and to First Focus again and CEHN for organizing this important discussion, and to all of you participating for taking the time to have this discussion with us today.
In the chat too, I think this is a good question by Tom, which is Tom Phillips. How can we integrate climate adaptation and resilience into healthy home and healthy, sustainable school programs? What are some good examples or model programs? So, and that seems like that's, and then anybody else who wants to jump into that.
Sure, and we could spend another hour, Tom, and I encourage you to follow up with me if you would like to have a deeper conversation here. I think we're seeing a lot of great innovation on the ground. One funding stream I'll highlight is the American Rescue Plan Act funds and the flexibility that gave communities. There was a clear mandate for the populations those funds were supposed to target and benefit, but a lot of flexibility. We've seen a lot of innovation happening at the local level of communities that are able to finally get past the siloed funding streams and have the flexibility to really invest in programs that achieve these co-benefits of these different climate and health and housing agendas. And happy to, if you follow up with me, point you to some examples and case studies of where we really see this being successful.
And Devin, love to get you in also, but what we've also found is you can break ground, I think, once there are things already in motion. So say there's a lot of green school type of programs and destination type programs and community garden and school gardening type of programs. So regardless of the age, especially elementary level, it's a great way to start with an appreciation for what is happening, the task at hand, and then trying to balance out, carefully, you don't want to scare people away, but balancing out what is in jeopardy, what is at stake, right? All this hard work that they're putting into that garden, or keeping up the grounds or beautification day or whatever it is. There are a lot of science curriculum programs in particular, along with others, where they are starting to incorporate climate resiliency in a very creative way, using the arts and using our music programs. There's a lot of different ways people resonate and learn different. And I think we have to get creative about how to use that. And I'll even throw in our social media. Our younger people, who I would say in a vast majority are much more up to date with these issues than I was at their age, by all means, are using the savviness of technology and their social media platforms. So, TikTok, just to play on one, is, becoming a quick venue for getting information out. Psychologists are using it, especially during COVID, getting the message out if you need to talk to someone, in a creative, fun way, so that hopefully it breaks down some of the intimidation factor, which again, climate change in this entire field of work can be a lot to digest. Nonetheless, all the other ones we've packed in today. So I would just take advantage of what is already happening, where people are already showing up, and then trying to build from there versus trying to start something completely new.
Devin, I definitely want to get you in. Any thoughts on what you've heard or any other things you want to add to this?
I think everyone did a really great job of summing up a lot of the things that I was going to say. I would say I've really enjoyed hearing everyone else's responses for this particular question. I don't have a ton of background information on specific programs. My project was primarily kind of on the other side of it, but I know also I had a question in the chat about getting follow-up questions for my presentation. I'd be happy to provide my contact information or anything like that for any of questions like that.
No, I know we're kind of at time, but I saw Valerie's question. Why don't we take that one and then we can wrap up. And I do want to assure people that the recording will definitely be shared later this week, and you can go to, I think, several of our websites, but certainly you can come to ours at www.firstfocus.org, and we'll have the webinar fully there, and also we'll have slides and materials there. And if you want to contact us, we can definitely share. I don't want to put in public everybody's contact information, but happy to answer questions from people about that. So Valerie's question was, what gaps in data or direct sources are we missing to drive decisions?
I would say there are more folks analyzing the economic impacts, but I think we could elevate that a lot better and streamline that. Many of us feel you shouldn't have to go there, but if we have to, the health side is there, the science is there increasing. Yes, there's always gaps in science, but as far as the vast majority of trends that are leading to a lot of these negative health outcomes for our vulnerable, a lot of that is there for us. When you combine that with lived experience and actually acknowledging people's experience as part of our science and data and livelihood, that's helpful. But the economic drivers, the economic implications, the indicators, like Amanda mentioned, lost days of work, lost days of school, all the other components that aren't necessarily seen on a well or sick child intake, that are truly the full picture of what these negative health outcomes or these climate exacerbated events do mean for the average family, even if they're not in like a major hurricane this week. There are day-to-day, week-to-week implications happening that are chipping away at the stress level and the trauma level and the generational impacts.
Dr. Ruben? Oh, you're on mute.
Sorry about that. I just want to echo what Nse said. There is just a wealth of evidence that is just holding up everything we say. It's not like we're just speaking out of the blue, or we're imagining things, or we just thought this up. There is ample evidence. There are always elements that we still need to know, and that's what's going on. And there's always awareness to raise and new ideas to bring up. And in answer to many of the questions, I just want to take advantage of my being here for this moment to say, you ask about any question that affects the adverse health outcome, and it is like this. There's not one thing necessarily, but it's all cumulative. So I just wanted to leave you with that thought, that there isn't just one thing. It's usually multiple things and usually cumulative.
Amanda, and then after Amanda, Devin.
Great. Thank you. On the data question coming from the housing side, I think a major challenge that we have there is that we wait for kids to get sick first and people to get sick first, right? So we find out that there's lead in the environment because a kid shows up with an elevated blood lead level, or that there are asthma triggers in the environment because the kid's in the ED for, the fourth time in a month. And that's a really, really terrible way to approach and sort of solve these problems and invest our funds. And so I think there's a real need for us to have more proactive intervention and solutions so that we are intervening before children are exposed and harmed. And we have a lot of models for how to do that. I also just wanted to add, I think another sort of theme for a lot of these questions about what are the data gaps, what are the priorities, how do we, sort of integrate across these programs that bears mentioning, is the community engagement that is needed. And I think that we're starting to see happen even more meaningfully. I think one of the programs that my organization is excited about in the Inflation Reduction Act is the climate justice grants that require community-based nonprofits being involved, and really hopeful that those grants will have an opportunity to be really community directed, so that we don't, the residents see all of these intersections, right? They understand how all this is connected. They know what's meaningful for their communities. So I think that's an opportunity as well.
I also wanted to speak a little to the comment that Dr. Ruben made about looking at the cumulative impact of each of these things. When you try to looking at the literature, there's a ton of just evidence that shows each of these factors and the effects that they might have on health, or the effects that they have on each individual aspect. But my project specifically is primarily looking at cumulative impacts. And I think that it would almost be like reductionist to try to boil it down and try to look at, okay, well, the thing that is causing this health impact is this specific environmental factor, because they are so interconnected and they are so like the cumulative effects are much bigger than each of the individual ones. And I would say that there's almost more of a gap in research looking at the cumulative impacts than there is at the research looking at each of the individual factors.
And I think that's an outstanding point. So anyway, I would love to keep having this conversation for hours with all of you all. It's like I've learned so much today, and I really appreciate all the people who came today to be a part of this. I saw your note, Catherine, and we certainly will think about having another webinar focused on solutions. And like I said, we will have the materials available. I just want to thank all of you, all the panelists, also for joining today's important conversation, and the expertise and passion that you all have for this. I think for young people, there's so many important issues, but this is among the top. And we also want to thank Senator Markey for his outstanding words and for joining us today, but also just his passion and leadership on these issues for years and years, and just ongoing commitment to this work. And finally, thanks to all of you who tuned in to watch today. We look forward to working with all of you, as well as congressional and administrative leaders, as we continue to create progress for kids and improve their environments. And if you can, we would love for you to tune into First Focus on Children's Annual Budget Summit this Thursday at 1:00, where we will unveil our budget book. And again, first time we'll have a chapter specifically focused on environmental health. We hope you can join us, and link to RSVP, I think, is in the chat. And also, I just want to thank Olivia Gomez from First Focus and Christy Truesdale from Children's Environmental Health Network, who really were essential in the planning of this webinar and their work. Anybody have any last words? And if not, we will thank you all. And all right. Well, thanks everybody for joining us today. And we look forward to continued conversations and working together to address these important issues. Thank you all.